Smith. My name is Asia. I'm going to be your nurse for the day. I came in to give you your medication and some nutrition through your PEG tube. Can you please tell me your name and date of birth? Alrighty, Mr. Smith. I'm just going to raise your bed up, but first I'm going to put on my gloves. Okay. Okay, Mr. Smith, you're going to have to expose your abdomen. Okay. Okay, first I'm going to auscultate, starting at the right lower quadrant, and then the right upper quadrant, the left upper quadrant, and then the left lower quadrant. I'll auscultate for a full minute. If I do not hear bowel sounds, then I'll auscultate for 5 minutes. While I'm here, I'm just going to go ahead and check for placement. I'll drop the syringe to 20 cc's. Open the valve. And then I'll listen for a swoosh, which I did here. So I'm going to close the valve. And then I'm going to aspirate gastric contents. So let me put my chuck down. Alright, so I open the valve and draw back. If it's more than 100 cc's, I would take note of how much residual is there. And then I come back in an hour. If it's still more than 100 cc's, I'll contact the provider. However, Mr. Smith is only at 50 cc's, so we're good to go. I'll replace that. Close the valve, remove the plunger or the syringe. Okay, and then I would fill these with 30 cc's of water, and then this one with 5. Crush my medication, and put my medication in the cup with 5 cc's of water. And then begin to administer the medication. So I insert the syringe, open the valve, start with 30 milliliters of water, and then I would administer the medication with 5 milliliters of water and flush that with another 30 milliliters of water. If I were giving multiple medications, I would flush them with 5 milliliters of water in between each one, and then end that with 30 milliliters of water. So I'm finished administering the medication. I'll just go ahead and remove the syringe, and then I'll begin to do the feeding. So I would come back and check my patient's ID, 2 forms, and then I raise the bed. I'll go ahead and auscultate the abdomen again, and then I'll check for placement. So that part I'll do over. So I'll place the chuck back down again. Insert my syringe. Correction. I'm going to draw up 20 cc's. I'm going to insert my syringe. Open the valve. And listen for a swoosh. Alright, so the tube is in the right place. And then I'll go ahead and begin administering my nutrition. Before I administer my nutrition, I'm going to check for residual. So I insert my syringe, open my valve, and draw back. Okay, Mr. Smith is only at 40 cc's, so I can go ahead and administer the nutrition. Close my valve again. If it's less than 100 cc's, we're good to continue. If it's more than 100, I come back in an hour, assess the residual again, and then call the provider if it's more than 100 when I come back. Okay. Let's go ahead and remove this. Okay, so I'm gonna fill these with 30 milliliters of water each. I'm going to take my Jevity 1.5 and shake it vigorously and then administer it. Correction, I would put the 30 milliliters of water first and then administer the nutrition. If it were to become occluded, I would take the plunger, insert it into the syringe, and pull back on it, and that should correct it. And then I would continue with administering the nutrition. Once that's done, I'm going to flush it with 30 milliliters of water again, and then I would close the valve, remove the syringe, and make sure my patient's comfortable, and after that, begin to document. The things I'm going to document are patient tolerance, the type of nutrition, the Jevity, the medication I administered, the amount of fluid I put in to the PEG tube, and the date and time. Thank you, Mr. Smith. And then I'm gonna put the bed back down so my patient doesn't fall. All right, are you comfortable, Mr. Smith? Yes, okay, here's your call light, and you just let me know if you need anything. I'm done. And then I open my